second guess, right? Like if there's an aneurysm, so for instance, one of the surgeries is where there's a bleb on a blood vessel, and if that ruptures and it starts to bleed, we have to really get in there quickly, but not only get in there, so I position the patient, and then I make a couple of burr holes in the skull after I move the skin back, and then I connect the dots, and then I take the skull off. That exposes the surface, or the dura mater, which means tough mother. So the dura mater is the opening, the covering over the brain. I cut that, I open up, and in someone who's got a hemorrhage, they're bleeding, when there's a spot, there's about this big, that's all you can see in the surgical field, and you just see blood. And so now what I have to do is I have to remove that blood, and the aneurysm is still bleeding, it's pumping up, and then I have to place these temporary clips on where I think the blood supply is supplying that particular blood vessel where there's bleeding. And so you don't have a lot of time. So when you mention double-minded, like the Holy Spirit will direct me, you got to do this right now. Once you place those temporary clips, for every second that the temporary clips are on to stop the major bleeding so you can see, blood vessels are losing oxygen and they're dying. And so if I'm just freaking out because I can't see this impossible situation, which oftentimes we face in our lives a lot, all of us, in different areas, if I freak out, that person's going to lose function of their life, right? And so being double-minded isn't an option, so you have to be very definitive. And so I can be confident that the Holy Spirit is saying, you need to go this